Intermountain Medical Center has a new tool to identify patients with pulmonary disease.
Yeah, the tool can also predict the future risk of being hospitalized. News 3 Utah's Ray Chin filed this report on how that helps doctors intervene quicker.
Researchers call it a risk score tool, identifying patients with chronic obstructive pulmonary disease, or COPD. Regular lab tests are used to predict future hospitalizations.
And I've had it for going on 10 years.
74-year-old Rue Webster of Murray was a truck driver.
Drove all 48 states.
Long before he took to the road, he smoked.
Oh, yes. Oh, yes.
How many years?
I started smoking when I was a teenager.
But Rue started slowing down and eventually diagnosed with COPD, a disorder often associated with smoking, which can cause emphysema, chronic bronchitis, or inflammatory lung disease. But there could be other factors that cause chronic obstructive pulmonary disease.
The occupational exposures, air pollution is actually associated with increased risk of COPD.
They told me what to do, but I never did it.
Intermountain Medical Center developed a new risk score tool validated in more than 132,000 patient records called the LIVE score.
With just routine labs that people might be getting at their doctor's office or the hospital, we would be able to predict who are the people that have the highest risk of being hospitalized or the highest risk of dying, and then really target specific care management programs or pulmonary visits or other interventions to that group.
Rue could potentially benefit from this tool to reduce emergency room visits. He's been hospitalized roughly 9 times since November.
Yeah, I didn't think this would get to this point. I really didn't. I thought, oh, well, I'll just have a hard time breathing a little bit. But now I can't walk from here to that wall.
The study also highlighted the overall health of the patient and other problems associated with COPD.
It's easy to understand because smoking is the major risk factor for COPD, and it's a major risk factor for developing coronary artery disease. We focus on patients as having one specific diagnosis, such as COPD. But the reality for most patients is that they have multiple diagnoses.
Rue quit smoking 3 years ago and has a message.
You know, my big thing is quit smoking. Do what you're told to do, because it's no fun the other way, because you don't have a life.
COPD affects some 15 million Americans. There is no cure, but there is treatment for symptoms, including medication, inhalers, physical training, and oxygen treatment. In the newsroom, Ray Chin, News 4, Utah.